Can you give me some specific examples of the technology at work?
Sure. So, among frontline health workers, there are a lot of platforms and systems that are providing decision support. So, when they're doing their household visits, they know which households to go to, they know what is happening at the household. They can work their way through checklists as they diagnose different problems at a household level. That information can get fed back into a health information system that enables the Ministry of Health to work through some of the supply chain issues, as well as knowing where to allocate resources, and just get a clearer snapshot of what's happening in their country. On the direct-to-consumer side, we're seeing, a lot more work being done with remote patient monitoring, particularly for chronic illnesses such as diabetes, cardiac or cardiovascular problems, and then aging populations, which is something that is increasingly becoming top of mind for countries as they're both dealing with challenges with maternal and child health. They're also dealing with large segments of the population that are growing older and want to be able to stay in their homes for longer periods of time with support.
And then what kind of actual devices are we talking about? I mean, it's probably a broad range, but is it like mobile phones? Is it specific proprietary hardware?
So it ranges in everything from your basic handsets that can only do voice and texting. Then you get into feature phones that still run Java, that then into smarter and smarter phones. So you've got, the Android market, you have the iPhone market. Increasingly, tablets are making their way into the health system, which is really exciting. And then, of course, you need computers on the back end of all of these different systems to really make them work. Then you have the servers, the networks, et cetera, and larger data centers, and an increasing shift to look at cloud computing.